We need the link, Pastor D.
And coming in. 40 seconds.
How far is the link?
Come again?
How far is the link?
This is only when I've managed for YouTube. We're only live on Facebook currently.
Good. How far is the link?
Okay, you can check on Prism Africa. It's there.
Have you copied me?
I'll send you.
Good.
Okay.
Welcome back. We had a technical challenge. We're trying to call our guest today, who is Susanna Rouse from South Africa in Gauteng province. But I believe that we have sorted this out now. So we should be live and connected to Susanna live. So let's try that call and Suzanne, thank you so much for having us once again.
My pleasure.
Now we can hear you loud and clear. No problem at all. I apologize. The link has just been created. I'll post it after we chat. You can watch the program to the end. You can even watch yourself. You can replay it. But it's live right now on Facebook. It's live on YouTube. I'm going to share with you when you begin to talk. All right? So
Okay, no
we
problem.
want to know, I'm sure you've been following the trends globally, but also regionally. Zambia only has about 3,800 cases of confirmed coronavirus cases, and South Africa, on the other hand, is number 5 in the world with more than 400,000 confirmed COVID cases. I know that you don't work for the government, and I know that you're not speaking on behalf of the government, and I know you're not speaking on behalf of the institution you work to, but as somebody who is resident and staying in South Africa, what is the situation right now?
Okay, so maybe once again, thank you for having me. Maybe I can do a quick backdrop
Yes.
on the states as to up to the 23rd of July.
Yeah.
So if you look at the state, South Africa has got a population of 57.78 million people. Okay, so far we've conducted 2.6 million tests. And then, as you've said, that we've got like 408,000 positive cases,
Yeah.
of which most of them are in the Gauteng province. But we also have more than 50% recovered rate of 236,000.
Okay, that's
And we've
good.
got 6,093 people that have died. And yesterday morning, we woke up to the sad news that we've had within 24 hours, we've had 572 people that died, of which 400 of them was in the Eastern Cape. Currently in our ICUs in the hospital, we've got 509 people that's COVID positive.
Yeah.
That's occupying our ICU. And daily cases receiving treatment in our hospitals are 165,000. And within 24 hours, we have about 13,000 positive cases. So that is what we're sitting with at the moment. It's tough, yeah. We've rised within no time to be number 5 in the world.
Absolutely. Do you think, from the community perspective, that in the next 2 or 3 weeks you might overtake Russia?
You know what? If we don't change our behavior,
Yeah.
we might. Because currently we are at a peak. So it is possible.
Yeah, absolutely. I agree with you. What do you think South Africa should have done differently that they didn't do in the beginning of the pandemic?
Okay, so I doubt we would have been able to prepare for such a magnitude of the SARS virus. Remember, this is the first time such a thing has happened.
Yeah.
For countries like the USA, they are struggling.
Yeah.
So
Yeah.
I doubt we would have been able to prepare for such.
Okay. So, but currently,
Yeah. Our,
proceed, please. You can proceed.
okay. So what, as you know, as from the 26th of March, our president tried by doing the level 5 lockdown. What we've seen with that was that the spread of the virus slowed down.
Yeah.
But then obviously people complained, and then things were changed, and then we saw the numbers surging.
Are there some issues, or do you think there are some mistakes right now that you think maybe other countries like Zambia can avoid?
This is only behavioral. Remember, the virus doesn't move.
Yeah.
We move the virus. So this is all our behavior. And it's basic. It doesn't even need all these monies that we are pumping into it.
Yeah.
If only we can change our behavior, honestly speaking.
I hear you, and perhaps this is I don't know if this is an African problem, but this is the problem you have right now in Zambia. You ask some people to stay home, those who don't have reason to move out of their homes, but they think we are trampling on their rights of association, assembly, and movement. But
Exactly.
how do you describe, and in no way are you representing the government, but how would you describe political will on the fight against COVID in your country?
Okay, so the behavior of a nation is usually led by our political leaders. The way we behave is how we are led. So we've seen, and you guys have seen on the news, 500 billion rand was pumped into this.
Yeah.
But yet every day corruption news comes up, and the people that's supposed to be helped are not getting that help. So greediness has really affected the management of COVID-19 by our leaders.
Yeah, yeah. Do you have a lot of political leaders, maybe members of parliament, ministers that have had the virus already?
Okay, so far I think I'm aware of 2 ministers. That was, I know, 2 of them were admitted.
Oh, wow.
Due to the virus, yeah.
I think we have more than 25 in the country.
Oh my goodness.
Maybe more than 30 in Zambia. Members of parliament, 3 of them ministers. From the numbers that have been released today, we could have more ministers from that list. Suzanne, when you look at the slums, I know the slums of Johannesburg are not the same as those of Zambia. I know the slums there are very congested. Have you noticed any challenges in terms of advising people to practice social distancing or practice hand hygiene?
Okay, so social distancing is a problem. And as you say, especially in our, you call it slums, we would say maybe in our squatter camp.
Yeah.
Places are congested. You'll find 5, 6 people staying in a small room. So social distancing, unfortunately, is not possible. And hand hygiene also, we also have challenges with water supply, which comes back to service delivery. So you can tell people you need to wash your hands, but there's no water for them to wash their hands with.
Absolutely.
So yes, there are people that are very good at social distancing, etc., and doing the hand washing if you've got the means. But then there are other people that really, unfortunately, it's just not possible.
Yeah, and I know that perhaps just like any other poor African country, we have quite a lot of people that are staying in these squatter camps or slums or ghettos, whatever you want to call them. Should we expect perhaps more cases from these areas because obviously no one is going to build big houses for them overnight.
No, most definitely. Okay, so I'm working in Soweto, and it's one of the biggest townships
Yeah.
in South Africa. The numbers are rising, and it's scary. I mean, if you find like old people that really don't go anywhere, but yet they are the ones dying because of COVID, you will find they've now said that we can have 100% capacity in our public transport. What does that mean? The taxis are full, the children are going to their jobs, they contract the virus, maybe they don't show symptoms,
Yeah.
they come home to the elderly that has got comorbidities, infect them, the elderly get sick, and they die.
Yeah.
You understand? So, yes, where there's congestion, definitely the numbers will increase.
How is the situation in hospitals? Is there enough capacity? Because having more than five, you have close to 600 deaths a day. That sounds like beyond imagination for small countries like Zambia.
Okay, so I remember in June there was a stage whereby in the news the hospitals are full, 100%. There's no space. But you must also remember that was the time where the alcohol ban was lifted.
Yeah.
So we had a lot of trauma cases. That now you need to choose somebody with a gasping wound of blood and somebody with respiratory difficulties.
Yeah.
Who do you take? Or somebody with coming from an accident scene due to drunken driving, and somebody that needs oxygen. Who do you help first? So since now we are back with the alcohol ban, things have settled a bit. So for now we are able and we are managing, and also because we've got centers where we are sending some of the less urgent, less sick people to go and recover, where there's doctors and there are nurses that are looking after them.
Yeah. Yeah. So the alcohol thing is very big because it makes headlines each time there is a mention of alcohol.
Definitely.
In the country. And I know that in Zambia, this is also the battle that we have. Bars have been closed, but we have a lot of illegal entities that are selling alcohol illegally to people. And this is a problem in the third world, particularly because, honestly, how do you value alcohol over your life?
Over life.
Yeah,
Yes.
we have learned a lot from what you have said, Suzanne, and I know that my viewers have picked quite a lot. But what would be your last message to the viewers watching in Zambia and across Africa?
I would like to say, as I said earlier, the virus doesn't move. We move the virus.
Yeah,
Can we please not go to public places unless it's really necessary? And instead of the whole family having to go to the mall, can one person of the family go, get the basic stuff that's needed, and come back?
yeah,
If you don't need to be at the hospital, try and treat yourself at home. Push fluid, wash your hands regularly if you are able to. Surfaces that you touch on a regular basis with normal soap water or put jig in it and clean down. You really don't need a lot of money to curb this. Stay at home, avoid touching each other. It's basic rules, basically.
yeah, absolutely. Suzanne, I want to thank you so much for taking time to appearing on my TV show. And I can assure you that
Thank you so much for
what you
having me.
have shared with us, we have listened, we are learning, we're following the trends in South Africa, and I hope that we can help each other as countries in conquering this demon in coronavirus. So thank you. Have a blessed day. Please have a chance to rewatch the program. The link has been shared to you already, or you can even follow my link on my Facebook page, Fred Chitangala's Zone, and you can just go through over what you've said and tag your friends, let them see what's going on so that we can do this together. So thank you and have a good day.
Thank you so much for having me once again. God bless you.
Bye-bye. Okay, so that was Susanna Rouse from South Africa. She's a nurse. She's a clinical associate as well as a clinical research associate down South Africa. Quite some inspiring issues. Some of the things that we are trying to grapple with as a country in Zambia, there you are. The issue of alcohol. When there was no ban of alcohol, the cases were going up in South Africa. When the ban was lifted, was removed, the cases were going down. Right now, they expect the cases to go down because they have removed that particular ban. And yet, here in Zambia, there are even drinking places where they are drinking like normal. Guys, you have seen the cases, what is going on. Just yesterday, we were 3,976. Today, we are almost getting into 4,000. This is the country that had 2 cases in March. This is the country that had no case at the beginning of March, and yet, the world was in millions. It's a choice we make. Like I always say at the end of this program, your health is your choice. It's a choice that we make. You can make a choice to go to town in a crowded place and go back home and infect your family. You can also make a choice to stay home. If you don't need to leave your home, stay home, but you can make a choice. It's up to you. This coronavirus is not joking at all. So anyway, I have a question, and the question I've posted on Facebook is, do you think the country is on course in its fight against COVID-19? Is there anything we should have been doing differently that we are not doing currently? I've got very interesting observations from everyone who has commented, and of course I'm going to pick a few because there are quite a lot of input from the people, and I know that everyone is watching right now. Okay, so let me start with somebody. This is a medical doctor who was President Rupiah Banda's doctor. Dr. Shailene Desai says, we need serious enforcement of the Public Health Act, and I call for the defense wings to move in, because adherence to the guidelines that we have been told is very poor. Go to town, go in minibuses, people are not wearing masks. People have stopped washing hands. We need soldiers to move in, just like they did during cholera outbreak. We need to map this disease properly, and it is the time to roll out the antigen tests and have serious data of the extent of disease. All those with antigen positive should be isolated if you are symptomatic at home and symptomatic in facilities. Private health facilities, institutions need to be roped in seriously, trained on swab collection, and help with mass testing exercise. And this is something that we're not doing. We have left private hospitals to do their own business as usual. And yet, we need their capacity. You know, right now, we all know that testing is not being done where it's supposed to be done. And yet, we have private hospitals in those facilities. Why can't we take the capacity for them to test in there so that everyone who goes to a private hospital is tested mandatorily? It's not supposed to be a request. You go in a hospital, get tested. I've got a friend from church whose daughter lives in South Africa. She had a cut here. All she needed was a stitch. She goes to a hospital for a stitch. She gets tested positive and gets admitted. Not for a stitch, but for COVID. And thank God she's fine. That's what we need to do. The only way we can defeat this virus, first and foremost, is by knowing the cases and isolate them. Secondly, by following hygiene practices. All government lodges in towns like Lusaka, Kitwe, Ndola, Kasama, etc. must be taken over and converted into COVID centers. How is that? Very good. You know what is going on right now? I don't know if you have already said this in the beginning. There are some lodges and hotels that are now attracting those who are testing positive to book for isolation in their lodges. Why? Because there's no business. But also, we know that there are very few families that have got very big houses where they can afford to have this man who has tested positive to live on his own, far from the kids. 2-bedroom house, and we are 8 of you. How do you isolate? So there's a facility here. Hotels and lodges are opening up for isolation. And you'll be there for 2-3 weeks until you test negative. Boom, somebody has made the money for 3 weeks, 300, 400, 500 per night. That's a killing. So there is another business opportunity. So maybe this government or lodges, I agree with this gentleman, can be converted into this service. Some can be given to private sector to run in coordination with the Ministry of Health as fee-paying centers, and the money can be used to supplement public sector efforts and plowed back to buy pop swabs, tests, kits, PPE. We need a concerted effort with one goal. I agree with all the submissions that my friend has made. None political, just straight to technical issues. I've got John Musonda. He's a clinical officer. I promise I shouldn't be mentioning their names, but already I know. John Musonda is a clinical officer. He says, good question. In my view, we were doing very well on the fight against COVID-19, but everything changed when a new saying called new normal was coined. This saying was misinterpreted by many citizens, and many people relax on the public health guidelines. We are on the right track, but all we need is refocusing. Very true. When we say new normal, we are not saying it's okay, just go to a public gathering. It's a new normal. You get infected and you go back home. No. New normal means put on a mask. New normal. Wash your hands regularly. New normal. Keep your distance. That's a new normal. Not misbehaving. That's not a new normal we're talking about. Chiti says, when a political agenda and professional agenda are enshrined in one person, the professional agenda will suffer more. And again, I wish I can get more details on that one. And I know you're watching. And then Indao Changwe says, lockdown. We need lockdown. By the way, one person that I once featured on this program, Dixon Jere, was President Lupia Banda's special advisor in public PR as well. He said, this was yesterday, one of his posts. He said that when Kafue was registering high numbers of cases, Lusaka people said, lock down Kafue. Kafue was locked down. When Nakonde was registering high cases, Lusaka said, lock down. Nakonde was locked down. Look at what's happening in Lusaka. Lock down. Now you don't want to lock down, just because it is now affecting you. Kedi Mulenga, this is another ardent follower of our program, says, great question. Relatively, we are doing well, but we lack consistency. There is a lot of mixed messaging going on around. The public still lacks adequate knowledge about coronavirus and COVID-19. Most people I talk to think COVID did not exist until now. Some people believe in divine intervention only instead of taking personal action. Still relatively low levels of testing and contact tracing. We are at 20% effectiveness. That's not good. If you got 20% in a university, you have failed. You will repeat the course. We are far from, in fact, we all know we are far from where we need to be. I think it's because COVID is very expensive. I actually had an opportunity to be tested for COVID 3 days ago. I'm waiting for my results. I didn't test because I had symptoms. I tested because there was an opportunity. But who knows? Now we know people can be asymptomatic but still carry the virus. So I'm anxiously waiting for my results. And I wish I could show you the pictures. I think my director can go on my Facebook page. You'll see me being swabbed. And just show the people to be encouraged that there's nothing painful about being tested for COVID-19. If you have a chance to be tested, test, okay? You never know, you might protect your family and your relatives and your loved ones, your friends, because now you know you have COVID. Isolate yourself and you'll recover. After all, chances are that you will recover because there are very few people who are dying out of COVID compared to the total number of COVID cases. Quincy says there are statutory instruments and health guidelines that were issued which are not being adhered to. There is urgent need for authorities to step up the enforcement efforts. Individuals, too, have a personal responsibility to protect themselves from spreading or contracting COVID-19 by sticking to personal hygiene and issues that have been issued health guidelines by the Ministry of Health. We will keep singing this song I think you remember in the early 2000s, early 90s, when HIV was just getting there, no ARVs, how people were talking and how people were saying this is satanic, this is demonic, this thing is sent by somebody to help us, it's demon. And so many things were done. But hey, we didn't stop talking about this. We will not stop talking about this. Millions of people have died of HIV. And we know millions will die from COVID-19. We will not stop talking until it sinks in everyone's mind that this thing is real. You know, can you imagine what will happen if all of us start social distancing, if all of us start wearing masks, if all of us start washing hands consistently and regularly, COVID-19 will disappear. Like Susan said, this virus doesn't move. We move it. Wyson Banda, is another medical person, says, so much to be addressed. First, it started with the directors at the Ministry of Health who didn't understand what the pandemic is. Instead of strengthening preventive sector, they embarked on strengthening curative cadres, whose work is to see dead bodies. So let them treat patients. That's a technical perspective of this. Okay, let's go to public health before we go to medicine. Okay. Monde says, right now, we should have been doing massive screening. We should have started testing everyone, whether sick or not, especially in the most affected areas. And I think this is where the government is going now, because some of the cases that have been announced today were from routine testing. Maria says, my concern is how town, especially the city market, is crowded. It will be hard to control the spread with such crowds. It is hard right now because these markets are deadly congested. Yeah, some of us who love dry fish and dry carpenter and all these dry things, dry vegetables, beans, we are afraid of going there because what do? Now we have to go to buy carpenter in supermarket, which has been there for years, for months, and doesn't taste that good. Yeah? Joseph Daka says, politicians should walk the talk, more especially the ones in power. And at individual level, I think it's important for each one of us to start or continue following the health guidelines. Prevention is better than sorry. Now, everyone is saying the same thing. Okay? So who is it that is not following these regulations? It's a person on the streets. It's a person in the markets. It's a person who goes. Unfortunately, the same people are saying we have to start following these guidelines. Some people are going to these drinking places by night and drink and carelessly do whatever they are doing. And I have quite a lot of people. Please keep sharing them. Some of them I'm going to do a live coverage on my page, the live broadcast, just to go through and consider through a lot of submissions that you have made. But I want to thank you. We know that time is always not our best ally. I think somebody has stolen my time. I don't think my time has moved because something my director has done to talk to Pastor Dixon. No, it's my time. Yes, all those technical glitches I had, do you think my time is going? No, I'll sort you out, Pastor. But anyway, thank you so much. So, I think the message is clear now, okay? The message is clear. The virus cannot move if we don't move it. And it will never change. What we say will never change. Put on a mask. Wash your hands. Avoid crowded places. Keep the distance if you have to be in crowded places. We beg you, stop the virus from moving. There are some very innocent people that don't move. You will end up giving them the virus. My government, my beloved government, let's involve the military. We need to force some people to adhere to these guidelines. We want everyone alive. We're not happy to be hearing of 90% of our deaths are BIDs. You know why? Because people are still ignorant. Let's amplify public health education, sensitization on radio, door to door. The same thing that Honorable Doris did in the beginning. But we can do this with more protection among those who are carrying out those sensitization. This is the end of our program. We'll be back again with another interaction next week. I'm planning that for now I'm not going to have any guests because I care for you, but we'll be doing these interactions via phone, via WhatsApp, via Facebook, and we'll see what we can do together. Like I always say, please, your health is your choice. Decide what you want to be or how you want to be